Diabetes Explained. What you must know. Do you know that nearly 1 in 10 Americans have diabetes? Yes. You heard me right. Welcome to Health Pride, your ultimate channel for correct and accurate health information. Diabetes is a growing health crisis affecting millions worldwide, but many people are unaware of the distinctions between its types. Surprisingly, the numbers are staggering. According to the International Diabetes Federation, there were over 463 million people living with diabetes in 2019, and that number is expected to rise to 578 million by 2030. In the United States alone, the Centers for Disease Control and Prevention estimate that over 34 million people have diabetes, and shockingly, 1 in 5 of them don't even know they have it. Despite its prevalence, there's still a lot of confusion surrounding diabetes, and that's why it's essential to understand the different types and how they impact our bodies. Surprisingly, diabetes is often misunderstood as a single condition, but it's actually a group of metabolic disorders characterized by high blood sugar levels. There are 3 main types of diabetes. Therefore, stick around as we uncover the different kinds of diabetes, their differences, and what they mean for those affected. Before we get started, please consider subscribing to our channel because it motivates our team to make more videos like this one. 1. Prediabetes. This is a serious health condition that occurs when blood sugar levels are higher than normal but not yet high enough to be diagnosed as type 2 diabetes. Prediabetes can occur when the cells stop responding to insulin, also known as insulin resistance. This causes glucose buildup in the bloodstream and can increase the risk of developing type 2 diabetes, diabetic heart disease, and stroke. It can also cause long-term damage to the blood vessels, kidneys, and heart. 2. Type 1 diabetes. This is an autoimmune disease that causes the body to produce little or no insulin. In case you didn't know, insulin is a hormone that helps control blood sugar levels. Experts believe that genes and environmental factors, like viruses, may trigger type 1 diabetes. Not forgetting, type 1 diabetes symptoms include chronic thirst, frequent urination, chronic fatigue, blurred vision, and diabetes unexplained weight loss. To make matters worse, high blood sugar levels can damage blood vessels and lead to serious problems such as diabetic nephropathy, diabetic retinopathy, diabetic neuropathy, and diabetes heart problems. But the good news is that people with type 1 diabetes need to take insulin every day to manage their blood sugar levels. They can use an insulin pump or pen to deliver insulin. 3. Type 2 diabetes. It is a chronic condition that occurs when the body doesn't use insulin properly, resulting in high blood sugar levels. Type 2 diabetes occurs when either the body doesn't make enough insulin or doesn't respond to it properly. This insulin resistance can be caused by a number of factors, including being overweight, not getting enough exercise, and genetics. This diabetes type has warning symptoms such as increased thirst and urination, increased hunger, blurry vision, and chronic fatigue all the time. Over time, type 2 diabetes can cause serious damage to the body, especially nerves and blood vessels. These diabetes complications include retinopathy, neuropathy, nephropathy, and diabetes heart failure. The interesting insight about this diabetes type is that it can be treated with lifestyle changes, medication, and blood sugar monitoring. There's no cure for type 2 diabetes, but you can manage it to keep your blood sugar levels in a healthy range. Not only that, but also early diagnosis is important to prevent the worst effects of type 2 diabetes, and the best way to detect diabetes early is to get regular checkups and blood tests with a healthcare provider. 4. Gestational diabetes. It is a condition that occurs during pregnancy when the body doesn't produce enough insulin to meet the additional needs of pregnancy. Gestational diabetes can occur at any stage of pregnancy, but is more common in the 2nd or 3rd trimester. It's usually detected around weeks 24 to 28 of pregnancy. Sadly, gestational diabetes symptoms are not obvious like any other types of diabetes. High blood sugar levels during pregnancy can increase the risk of pregnancy problems, such as a large baby, miscarriage, high blood pressure, and preeclampsia. Treatments for gestational diabetes usually include dietary changes, exercise, and preeclampsia tests to know what exactly to treat. When caught early, gestational diabetes can be managed effectively without causing lasting health problems. In summary, each type of diabetes has its distinct characteristics, and understanding these differences is vital for effective management and prevention of diabetes-related complications. Members, if you found this video helpful, consider watching our next video on diabetes management tips and share your thoughts in the comments below. Thank you for watching.